We've talked previously about some of the internal validity issues that you might have, and again, that's are we drawing the right inferences from our study? And now I'm going to sort of briefly talk about, because again, the stuff that I refer to you to read does talk about this also, but some of the solutions that you can build into your research design to address them. Not always solve them, but address them and see if they exist. One of the first ones we talked about was history, right? A big event that changes the way things happen. And one of the ways to solve this is or to address this, I should say, is to have a control group, because if you have a control group who's not getting the intervention, or a group of people who are not experiencing the disease, or who are, if you're talking about the compliance, who are compliant that you can compare them to, then you can see if this historical event had the same impact on them. So if I could look at nurses who got higher degrees, the numbers and the types, before the Affordable Care Act, another case we talked about before, then I could compare that group to the group that got them after the Affordable Care Act. How are they different? What kind of degrees did they get? Where did they move? How long did they take to complete their degree? Again, I have that comparison group to see the impact of that policy. Was that historical event what changed it, or were these things that already happened before? That control group you can compare on lots of different levels. It also helps with maturation. Now, maturation, remember, is a change that would have occurred naturally with an older population or a younger population. My favorite example is Does Sesame Street help people to read? That's a program intervention, right? The problem is that if you include kids from age 3 to 6, kids about 5 or 6 learn to read with or without Sesame Street, right? So one of the ways that you would do that is you would isolate, you control and minimize the time, or you would compare 3-year-olds to 3-year-olds that got Sesame Street, the intervention group that got it and the group that didn't. So those are kinds of things you need to think about, especially if you are going to do an intervention on a program, or you're going to look at outcomes. You would really need to compare ages to ages. Sometimes maturation has to do with education levels too, that you would control for, because these are things that would happen normally. If you're looking at interventions, sometimes when we look at stuff, people who have had cancer before, the intervention may not be as impactful to them, or people who've had diabetes a long time, the intervention might not be as impactful to them. So you'd want to do a control group that had it a long time, and an intervention group that had it a long time, an intervention group that had it newly diagnosed, and then a control group that had it newly diagnosed. So again, you want to match people based on those important variables of maturation, because we know that that does change outcomes, okay? One of the things too we talked about was testing, right? That if you take the test a couple times, like your GRE, hey, you do better. What you probably did was learn how to game the system, not really gain that knowledge. One of the ways to do that is you want to limit familiarity with the testing. You can either minimize the time that they have between testing, so they don't have that extra time to read or brush up on it, or you can make it much longer so that they're probably going to forget what they've learned, or other things are going to happen. Again, a control group is good that didn't take the test just to see. Mortality, there's not as much you can do. People who want to drop out can drop out. You can ask them why they drop out, so you can sort of see, does there have something to do with women drop out, men drop out, who's dropping out. We did see people dropping out of some of our studies that we've done about health literacy. Once they took the first exam and they were going on to the next, they would say, oh, well, I don't have my glasses. And we did see that the people who dropped out, the mortality from the study, were people who, and that would be in this case people who didn't complete both tests, were people who were older and who had a harder time reading the test the first time, and had to have us administer to it. Now, can we say that they were illiterate and they were just making this up about their glasses? No, but we can note what kind of people did drop out, and we would report that in our results, which is, again, is important, because you're going to create some work that people are going to build upon too and use for lit reviews in the future, and we need to know who dropped out and who didn't, even if we can't exactly figure out why all the time, right? Testing, again, the number of times you're tested. Instrumentation, we really have to use the same instruments each time. We can't really sort of change that around. So we just have to make sure we use the same instruments at the same time. Measurements can't change. Statistical regression, it's really hard to do that unless you get a control group that's also an outlier group that doesn't get the intervention. So again, if we go back to people who've had diabetes for a long time, control group who's not getting your intervention, and we're comparing them, and if they are both the same number of years, then they're both outliers. If this program does or doesn't impact their diabetes compliance. Selection, Again, it's just very, very difficult. You want to have a control group that matches on some important variables. So whatever your lit review would tell you as an important variable, you would match on that variable to have a group that gets the intervention and a group that doesn't. Again, some of this is really hard because and it raises ethical questions, because what if your intervention is really impactful? Then don't you want to give it to the control group? Yes, you would. And usually with medications now or interventions, if 20 to 30% of people do see an improvement, we then stop the study, or we then stop only giving the intervention to the intervention group, the program, whatever, the education, and then we do give it to the control group, which means eventually we lose the control group and we have to try again to get another control group. But ethically, that is the better way to do it.